technical challenges there? So, for example, if you have your summary care record, how do we make sure that follows you around where you're going? Are there kind of technical issues that perhaps the private sector have learned from, whether it's internationally, especially say some of your members who are actually speaking at Hare later, like Centene Healthcare, major multinational organisation, you would assume they probably address these challenges beforehand.
Yeah, if you look at a healthcare system like Hare Salud in Valencia, which for 25 years has been delivering really effective integrated care, they have an electronic patient record for every user in that system. That record will move with that individual no matter whether they're in a hospital setting, a care setting. They can see that record, they can input data onto that record, they can manage that, it's theirs, it's not something that's sort of gifted to them, they control it. If they're in hospital, their drug use is managed through that record. We've got a lot of interoperability barriers within the English healthcare system and actually across the UK, which at the moment are not allowing systems to talk to each other. And actually we've got to break a lot of those down. Of course, the other barrier is cultural. Is the simple fact that in acute care we have a different kind of culture to primary care. In publicly funded organisations, maybe a different culture to those in privately funded organisations. So we've got to get over that cultural challenge as well. And of course the funding mechanism is somewhat different as well. So you've got a taxpayer funded universal system within the NHS and largely a privately or local authority funded service within social care, which again don't naturally talk to each other. So we've got to overcome a lot of those hurdles in order for the end user to simply see it as one system they can move their way through in a seamless fashion.
And this is actually, I think, when you're talking to patients, perhaps it's not always clear necessarily. That's the question I put to you. Do patients care who's providing it, as long as it's free at the point of use? Or is there a kind of a more underlying cultural issue where they say, actually, no, I want to make sure whatever is NHS funded and provided for, but actually...
Yeah, so we've looked at this in a lot of detail. People get very scared by the term privatisation, which gets used an awful lot. And actually what they think that means when it's used in an English NHS context is either the NHS is going to be sold off, or they're going to actually have to get their credit card out and pay for care after they've had it. Of course, neither of those things are happening, and neither of those things are consistent with a private organisation delivering an NHS service that is free at the point of use. But people naturally are concerned. Actually, when you ask the question, do you mind who provides the care, providing it's high quality and free at the point of use, the overwhelming majority of the public don't mind that. And of course, that's evidenced by the fact that millions of patients every year choose to be treated by a private sector organisation, paid for by the NHS, more often than not to a very high standard. If there was a really inbuilt resistance to that, I think what you'd start to see is patients saying, I don't want to be treated by the private sector. Actually, the counter is true. They often do, providing it's free at the point of use and report.
Yeah, that's the thing. If you can receive the best quality healthcare,
that's what matters to you.
That's what matters. Now, looking forward to Hare, 1st and 2nd of October later this year. What are you looking forward to most? Kind of, why is the IHPN a supporter of Hare?
Yeah, so IHPN has supported the conference for a number of years now. We're really looking forward to this year's Hare. It always brings together a really diverse range of people, a really senior level of folk from across the healthcare system. What we're able to do is come and talk to that community about what we're working on, what our members are working on, the change that's underway. You get a really sort of dynamic spirit and some really interesting sessions, but also when you're walking around the hall, you're talking to lots of different people. Great networking, great opportunity, and a place that we think is a must-attend event every year.
Thank you. Well, thank you very much, David. I look forward to welcoming you and your co-panelists, and indeed the rest of you, at Hare later this year, from the 1st to 2nd of October at Excel in London. Thank you very much.